Hello, my name is Rachel, and I'm an addictions counselor here at CMHA Thames Valley Addiction and Mental Health Services. This video is step one for family members, close friends, and significant others who are currently trying to support themselves and their loved one who may be experiencing an addiction. The second part of this is our live family group, either virtually or in person. If you're not sure if you've been signed up for that group at this point, please do reach out to us. We'd be happy to look into it for you. You can connect with us at 519-673-3242. The purpose of this video is, number one, to present models, techniques, and principles of addictions treatment. We hope to give you a better understanding of the different approaches, evidence-based, and research that is used in addictions treatment. We will also take time to talk about the addictions treatment system. If you've ever tried to find supports for yourself or your loved one who's experiencing an addiction, you probably know just how confusing this system can be. So I want to give you a better idea of what options are out there, what options might be good ones for yourself or your loved ones, and how to access them. And lastly, I want to take some time to address how addiction impacts the entire family. We know that sometimes family members feel left behind as the person with the addiction becomes the focus of attention. However, we want to highlight how addiction does impact you, the people around you, in addition to the person who is actually experiencing the addiction. But first, let's start with a message that's very important to remember as an individual who's supporting somebody else with their addiction concerns. It is not your fault. You did not cause it. You cannot control it. You cannot cure it, but you can cope with it, and you do have choices. This is to be the focus of the live family group, to remind you that you can cope and your family does have options related to how they recover from the impact of addiction. As well, a quick reminder to please grab a pen and paper and bring along any questions you might have remaining after this video to the live family group, as we will be happy to address them then. Okay, so now let's start with some definitions related to addiction. Addiction is described as the uncontrollable impulse to repeat a behavior regardless of its consequences. And as somebody outside of the situation, we might see these negative consequences and think, why is it that my loved one continues to engage in this behavior, despite the damage that is doing to their physical health, mental health, social relationships, job, school, etc. But to the person who's experiencing the addiction, it really does feel like an unresistible urge at times to continue using. Addiction is also defined by the presence of the following characteristics. Number one, it's preoccupation and primary. Continuing the use or the behavior becomes the focus of that individual's life. It's the priority above all other life aspects. It's progressive, or there is progression. Behavior or use and its consequences increasingly become worse over time. Presence of tolerance and withdrawal. Tolerance is over time, a person may feel the need to use with increasing amounts in order to achieve the desired effect. And tolerance occurs when an individual experiences physical consequences as a result of discontinuing their use. These physical consequences or withdrawal does occur in both behavioral addictions as well as substance use addictions. And as I just mentioned, there are these two types that we offer treatment for and provide support for here at CMHA Thames Valley. There are substance use addictions, otherwise known as chemical dependencies, which develop when an individual introduces something into the body. Common things that we hear are the THC in cannabis or alcohol. There are also behavioral addictions, otherwise known as process dependencies. Common forms include things like gambling or video gaming. These develop when an individual engages in one of these behaviors, and over time, the dopamine response that we experience can become problematic to a degree where we feel like it's uncontrollable. This is the iceberg analogy of addiction. It's something that we use because it really helps us to understand why a person continues to use or continues to engage in a behavior despite its negative consequences. At the top of the iceberg here, we see the addiction. This is the use or the gambling or the gaming. This also is any behavior that might perpetuate that use, such as secrecy, theft, stealing, lying, things of that nature. What we don't see is everything underneath, the majority of the iceberg. These are the contributing factors that may be leading a person to continue to use as a coping strategy. These factors are hidden, which means that to the people around them, they might not even be aware that they exist. And as we can see, there's also a lot of different things that could exist under someone's iceberg. These could be things as extreme as trauma or abuse, or things that seem quite simple to us, like boredom or day-to-day stress. Frequently, our first response to addiction is to take it away. We want to take away the use, we want to take away the gambling or gaming, we want to take away the behaviors related to it. However, in treatment, we need to consider what would really happen if we simply shaved off the top part of this iceberg. Well, much like with a real iceberg, everything else will come floating to the top. And as I mentioned, these can be extremely painful things to deal with without those proper coping strategies and healthier mechanisms to do so. So it's not uncommon to see people return back to what they thought was helping, the use or the behavior. And again, this is why we spend a lot of time in treatment helping others, helping individuals understand the reasons why they are using and how they can find new ways to cope with and manage these factors. And for some people, there might be many, many factors under their iceberg. And for each one of these factors, we might have to try 2, 3, 4 different coping strategies to manage them. That can feel like a lot of work, and new strategies do take time and practice and patience to develop. They are rarely going to be nearly as instantaneously gratifying as the use was. This is why it isn't as simple as just saying no. However, it is worthwhile, as for many individuals, they might not only notice the top of that iceberg start to shrink away over time, but they may also notice some of the bottom of the iceberg shrink away over time as they find healthier ways to cope and don't feel like gambling or using is their only option. Next, I want to talk a little bit about the criteria set out by the American Psychiatric Association, or the APA, to describe a substance use disorder. Here at CMHA Thames Valley, we do not offer this type of diagnosis. However, understanding these criteria can be helpful in supporting clients in seeing the similarities in their own experience to these types of symptoms. A substance use disorder is described as a maladaptive pattern of substance use leading to clinically significant impairment or distress over a 12-month period. Number one, they may have reoccurrent substance use resulting in failure to fulfill major role obligations at work, school, or home. Likewise, their reoccurrent substance use may put them in situations where it is physically hazardous to them, such as operating a motor vehicle. Continued substance use may occur despite having persistent or recurrent social or interpersonal problems, which have been caused by or exacerbated by the use. They may also develop that tolerance. As I mentioned before, this is needing to use increased amounts of the substance in order to achieve the desired effect, or they may just simply notice a markedly diminished effect from using the same amount of the substance over time. As well, they may have withdrawal. These are the physical consequences as a result of discontinuing their use, and we're going to talk a bit more about what these consequences could be later. Or they're actually using the substance simply to cope with and reduce those withdrawal symptoms. Other criteria that one might experience are that the substance is often taken in larger amounts over a longer period of time than was intended. There is a persistent desire or unsuccessful efforts to cut down or control their substance use. A great deal of time is spent doing things that help them obtain, use, or recover from the effects of their substance use. Important social, occupational, or recreational activities might be given up or reduced or jeopardized as a result of the substance use. Substance use is continued despite knowledge of it having a persistent or recurrent negative effect on our physical or psychological well-being. And someone might experience cravings, strong desires to, and urges to use a specific substance. I want to recognize that there are stages of substance use disorder, and not everyone entering treatment experiences their addiction in the same way. Now, you might have been listening to those criteria and thinking to yourself, oh gosh, I think my loved one might tick off every single one of these boxes. That's to be expected. Typically, when an addiction has developed to a point where loved ones are noticing or someone is reaching out for help from loved ones, it's because it has developed to a point of feeling severe. I also want to note that the severity of someone's addiction is not a direct one-to-one indicator of how successful their recovery or treatment is going to be. This criteria simply helps us to understand where somebody is starting from when they enter treatment and what options or approaches might be a good fit for them. There are similar criteria set out by the APA to describe a gambling disorder. Now, gambling is the only behavioral addiction that's currently recognized as a potential disorder or as a disorder. However, problem technology use is currently under review as a potential disorder. Gambling disorder is described as a persistent and recurrent problem gambling behavior leading to clinically significant impairment or distress, again, over that 12-month period. A person may feel the need to gamble with increasing amounts of money in order to achieve the desired effect. This is tolerance. They may become restless or irritable when attempting to cut down or stop gambling. This is withdrawal. They may have made repeated unsuccessful attempts to control, cut back, or stop their gambling. They're often preoccupied with gambling, even when they're not actively engaging in it. They may gamble when feeling distressed, or after losing money from gambling, they may return back another day, often called chasing their losses. They may lie to conceal the extent of their involvement in gambling. They may have jeopardized or lost out on significant relationships, job opportunities, educational opportunities as a result of their gambling. They may rely on others to provide money to relieve the desperate financial situation they find themselves in. And the last criteria is an exclusionary one. It is that gambling behavior is not better explained by a manic episode. This is because some mental health concerns include manic episodes where an individual may engage in gambling during the episode, but does not engage in gambling when they're not experiencing the manic episode. So the gambling has more to do with the other mental health concern than it does with a gambling disorder. And again, we have some levels of severity here. And again, these only serve to tell us what levels of treatment or types of treatment might be beneficial for that individual at the point that they are entering services. Beyond the standardized criteria and the charts related to severity, this continuum is a really helpful way to understand addiction and how it might change over the lifetime. We all exist somewhere on this continuum, and we all have the potential to move up or down the scale at any point in time. On one end of the scale, we have no use. Here, a person at this part of the continuum is not experiencing any problems related to substance use because they have not used substances for an extended period of time. Next, we have experimental use. Here, a person might be using either for the first time or they're using very occasionally. People are typically using for enjoyment purposes. And again, they're doing it very rarely. If the experience is a negative one, someone is unlikely to use the substance again. However, if the experience is a positive one, then this behavior is reinforced. So this means if someone uses a drug and decides that they like it, they are more likely to use it again. With continued experimental substance use, we may notice someone move to the social or recreational part of the continuum. Over time, they start using the substance in more social situations. They might use here and there, they might use with certain people or in certain circumstances, but it isn't the only thing that they do for fun, relaxation, or entertainment. At this stage, substance use is not a problem. It is still a positive thing as the consequences of using are not outweighing its benefits. With continued recreational social use, we might notice someone move into the regular or habitual part of the substance use continuum. At this point, we typically notice substance use is becoming more frequent and in higher quantities as the tolerance may begin to build and people feel the need to use more of that substance to develop the desired effect. Psychological dependence might also develop here as an individual may begin to rely on the substance in order to complete certain tasks or experience certain things. Substance use may also have become more of a pattern here. It's becoming more habitual. Here is when we typically begin to notice that substance use, like I said, it's becoming a pattern, and there's the possibility of moving into the problem, abusive, and then dependency parts of the continuum. At these stages, we begin to notice some of those symptoms outlined in the DSM-5. We also hear people express that their substance use no longer feels like a want, but is beginning to feel like something they have to do in order to get through their day-to-day life. Very similarly, we have the gambling continuum. And again, we all exist on this continuum somewhere, and we all have the potential to slide up or down the continuum at any point in time. Likewise, we have a no gambling side. There's no gambling problem because there's no gambling activity. Then there's the experimental casual types of use. People gamble here for recreational reasons, for excitement reasons. It is one form of entertainment for them, but it is far from their only form of entertainment. If you ask them to stop gambling here, they likely wouldn't miss it very much. However, with continued use, we may notice an individual move into the recreational or social parts of the continuum. Gambling here has become a main form of entertainment. If you ask them to give it up, they may miss it, as it is something that they frequently turn to. They do not experience a loss of control, however, and here gambling does not come before family, it does not come before work or school. It's just a pastime still, but it is a serious one. As an individual continues to gamble in this way, there is the potential that they may move into harmful involvement. At harmful involvement, gambling is no longer just for entertainment. It has now become a coping strategy, a form of escape, a form of relief from other issues in their life, whether that be negative emotions or anxiety. This is where gambling, again, starts to have that potential to move into the criteria set out by APA as a gambling disorder and into that place of dependency, where an individual is experiencing significant harm to many different life areas as a direct result of their gambling. And a question we sometimes get after exploring these continuums is, why is it then that one person can try something once and never do it again? Well, another person can try something once and it seems like they rocket through that continuum extremely quickly, while another person might continue to use or continue to engage in a behavior over and over again throughout the lifetime, and it never seems to become a problem. Well, there are certain risk factors that might make us more sensitive to developing an addiction. And it's important to recognize that every individual is different. They come with these different risk factors, and having a number of these does not mean that we're going to develop an addiction in our lifetime, but it is something to be mindful of as it might make us more vulnerable to it. First, we have family upbringing or role modeling. If we grow up seeing people around us turn to substances or certain behaviors to cope with life's problems, then it's something that we grow to understand as normal, a normal way to deal with life. Genetic and biological factors. There have been studies that certain individuals just biologically seem more vulnerable to developing an addiction. However, biology is not destiny. It's just one of many factors, again, that might make us more vulnerable to it. Value-based. This is both in how we were raised, what we were raised to believe about substance use, as well as the things that we grow to understand as we come into our own adulthood. Cultural factors can play a big role, as there are going to be certain substances that are considered acceptable or unacceptable, depending on your cultural background. And that can be mixed for some individuals, as maybe they've moved or changed in that cultural setting in a lifetime. Peer group, some people might think that peer influence ends in high school. We know that that's not true. We're social beings and we care what the people around us are doing and what they think of us. So if we are surrounded by people who do use certain substances and perhaps use them in problematic ways, we ourselves are more likely to do the same. And on the other side, if we are surrounded by individuals who frown upon substance use or don't seem to use substances problematically, we too are more likely to follow suit. Self-esteem is something we commonly hear. Now, this plays a big role because if we don't feel confident in our ability to manage different areas of our lives, we may be more vulnerable to turning to substances to cope with the negative emotions related to that. Present or past trauma. Events in our lives impact all of us differently. Two people might experience the same event, and for one, they may feel okay, they may feel fine to move forward from that event, while for another person, it was life-changing. So much like we all react to different events differently in our lives, how we cope with and manage the fallout from those events or the trauma that may have been experienced is also going to be different. The trauma could have developed in childhood, it could have developed later in life, or still be continuing to this day. So again, trauma is a very common reason for using that we hear because it offers the instantaneous relief of negative emotions. Concurrent mental health problems can also play a factor, as most people who are currently experiencing an addiction are also experiencing some other type of mental health concern. Many people will self-medicate if they do not have access to proper or appropriate mental health services, as they do find that the substance has helped to reduce their anxiety or reduce their depression. And because we know that addiction is progressive, although it may have been helping at one point, we know frequently that the use and the consequences related to it are going to get worse. Likewise, learning disabilities or attention deficit disorders can also be a risk factor, as people who have these types of diagnoses, they react differently, particularly to stimulants, as this is actually what's prescribed to manage their symptoms. So again, if a person doesn't have access to psychiatrists or the proper medications, and they have tried stimulants and they've found that symptom relief, they may be more likely to continually return to that until they can find something that helps them manage it in a healthier way. Sensitivity for developing a gambling disorder involves all of the same risk factors that I just mentioned, as well as a few others. The accessibility of gambling venues. If someone lives particularly close to a casino, off-track betting location, a bingo hall, or if they have a cell phone in their pocket that they know how to download an app and hook up a credit card to, it becomes much easier to access gambling. A big win or an early win. We might think that experiencing a win must always be a positive, but because of the reinforcement that occurs in our brains when an early win does happen, we might begin to believe that it's easy to make money in this way. It offers a big rush of dopamine, of excitement, of pleasure. So we might be more vulnerable to returning back to try and experience that same high. Poor coping techniques, if there is a lack of other strategies to cope with difficult things in one's life, they may be more likely to turn to gambling. If there's a family history of addiction, this can play a factor, as well as if an individual is active in other high-risk activities. Some people just seem to be able to better tolerate risk, and therefore gambling doesn't seem as severe to them. If there's financial problems, or if an individual is trying to find a solution to these financial problems, we know that when these concerns arise, some people might see their gambling either as a solution or as a quick escape. However, we know that gambling is not a reliable way to make money because of the element of chance and the way that games are structured. Over time, even if there's been little wins along the way, we know that individuals are going to be at a loss. So this can become problematic as that positive reinforcement is still occurring despite the reality of what's going on. And lastly, physical health problems or chronic pain. Some individuals have reported that when they are gambling, they experience a numbing, enough of a distraction, a relief from their chronic health issues. So again, this can make us perhaps more vulnerable to developing a problem with our gambling. So now we've reviewed some of the reasons why an addiction may develop, both in risk factors and things that might exist under someone's iceberg, as well as what that use could look like over a lifetime. I want to turn to the specific types of substances and the specific types of behaviors that we provide treatment for and help with here at CMHA Thames Valley. First of all, let's start with depressants. Depressants slow down the central nervous system. So we're going to see things like slowed breathing, slowed heart rate, slowed movement. It also produces a sensation of relaxation. We're less aware of the events or the activities around us. The effects of that depressant can range anywhere from just general sedation, very mild sedation, all the way to general anesthesia, and in severe cases to overdose, where the breathing and the heart rate reduce so much that someone experiences that cardiac arrest. Here, I want to make note that naloxone kits are available on site from us, and we can offer that training, or you can find them at most pharmacies. Naloxone is the medication that will temporarily reverse the effects of an opioid overdose. And even if your loved one does not use a depressant, I would recommend getting this training, as there has been a lot of instances of opiates finding their way into other substances, even substances that don't make sense, like stimulants, which we'll address next. And the withdrawal symptoms from a depressant are going to produce the opposite effect. So we're tending to see restlessness, irritability, difficulty sleeping when we suddenly discontinue our use from depressants. Common examples include things like alcohol, heroin, tranquilizers, barbiturates, benzodiazepines, and opiates. I also want to make a quick note about alcohol and benzodiazepine withdrawal, as the withdrawal from these substances can also produce some potentially life-threatening effects, including seizures. So if your loved one is looking at stopping their alcohol or benzodiazepine use suddenly, I would recommend that you have a conversation with them and have them reach out to a medical professional or reach out to us here to get some support around how to withdraw from that substance and taper from that substance in a way that's going to be safe for their bodies. Next category is stimulants. These excite or speed up the central nervous system. We're seeing increased heart rate, increased breathing. That means increased alertness and endurance, also producing feelings of euphoria and well-being, decreased appetite or need for sleep. When it comes to an overdose from stimulants, we're tending to see things more like seizures due to that overactivity in the brain. And again, withdrawal from these substances is going to produce the opposite effect. We're tending to see people become very sleepy. They may have that increase in appetite. Common examples include things like cocaine, crystal meth, as well as things we see every day like caffeine, nicotine, and tobacco. When it comes to withdrawal from stimulants, if you know somebody is coming off of a long stimulant binge, I would recommend that you have someone check in on them, make sure they're moving around if they are sleeping, as we have had cases where people have been so sedated and so tired following a stimulant binge that they've fallen asleep on a limb funny and haven't noticed that there's actually been a lack of blood flow to that limb, causing nerve damage. The last drug category I want to make note of is hallucinogens. These cause distortions in our perception. So we're typically hearing and seeing things, hallucinating, that aren't actually there. This can dramatically affect our emotions and our mental state. And for some individuals, this may even produce flashbacks days, weeks, or months later if they perhaps have experienced a bad trip where they have had an extremely negative emotional reaction to those hallucinations. Common examples include things like LSD, PCP, psilocybin or mushrooms, ecstasy, and cannabis also lands in this category. Now, some people are surprised by that, but because cannabis has so many different chemical factors within it that produce so many types of responses in the body, including hallucinations, it finds itself in this category. And before I move on to the types of process dependencies or behavioral addictions, I want to make a quick note about what is happening in our bodies, both when we introduce a substance into it and when we engage in a behavior such as gambling. So let's look at this example first. Very simple way to show you what is happening when we introduce a stimulant like cocaine into the body. Well, in essence, we're getting the development of dopamine, that hormone that makes us feel good, produces euphoria, produces pleasure, makes us feel like we're on a high, we're on cloud nine. Now, here's our brain on gambling. Not introducing anything into the body, but we're seeing the same effect. We're seeing the increase in dopamine and experiences of pleasure. So in short, when we are treating a process dependency, we are treating a chemical dependency. And that's where some of the similarities come in addiction treatment for both of these types of addiction. I'm not going to go through all of the different behavioral addictions that we provide support for here. I just want to touch on some key ones. Number one is gambling. So as I mentioned, we're having that release of the pleasure hormone in the brain, excites or speeds up the central nervous system, produces feelings of euphoria, and there are withdrawal symptoms that produce the opposite effect. Much like with a stimulant, we notice people become irritable or tired or sluggish. Common examples include things like slot machines, bingo, scratch tickets, lottery tickets, horse race bets, table and card games, or any of these online also are included. Gambling really is anything that is risking something of value with the element of chance related to the outcome. The other common form of behavioral addiction that we provide treatment for is video gaming and other types of technology use. Again, release of the pleasure hormone dopamine in the brain. Again, feelings of euphoria and well-being, excitement of the central nervous system, and withdrawal symptoms producing the opposite effect. There are a plethora of games to choose from, plethora of social media apps or other ways to consume digital content across a wide range of devices. Some common ones, though, include massively multiplayer online role-playing games or MMORPG, real-time strategy, first-person shooter, sports games, fighting games, puzzle games, etc. So we know what the potential drug or potential behavior could be, but what are the actual signs and symptoms that we want to keep an eye out for if we think our loved one might be experiencing an addiction? I want to make a quick note that many of the signs and symptoms I'm about to mention could be indicators of other things going on, whether it be anxiety or depression or high stress. So really we're looking for a few of these and sudden changes in these. Perhaps there's the unusual hostility, irritability, or secretiveness. Maybe they've suddenly had a withdrawal from family and friends, or you've noticed a sudden change in friend groups. Resistance perhaps to discipline or to feedback. Maybe there's a pattern of dishonesty, stealing, trouble with authorities you've noticed. Maybe they have a possession of a large amount of cash, or they have debts and are asking to borrow money. Missing items, maybe they're selling their belongings. Again, maybe there's stealing or missing of other medications. There's a drop in grades, perhaps, a sudden increase in absences or tardiness, poor concentration and short-term memory, slurred speech, loss of motivation and interest in activities they normally would engage in or would find enjoyment in. And perhaps there's become a lack of concern with their appearance or their hygiene suddenly. So like I mentioned, this could be signs of lots of things. So I also want to make mention of some evidence that's more likely to make us wonder or likely to provide proof that someone may currently be experiencing a concern related to addiction. Items of possible drug use include tiny Ziploc bags, sometimes called dime bags. Frequently, substances are sold in these. Pills or powders that are unexplainable, syringes, and scorched utensils. Items of potential behavioral addiction include casino receipts, Winners Club cards, scratch tickets, or in-app purchases that you can see on e-transfer, either from games or from gambling websites like OLG. You can also pay close attention to those physical signs in your loved one that they may be struggling with an addiction. These sudden changes and what's going on the exterior. Do they just have a general unhealthy appearance? Maybe there's diluted or shrunken pupils, or maybe you've noticed just sunken eyes, bloodshot eyes, constant runny nose or cough, major changes in eating behaviors and sleeping patterns. Maybe there's been a sudden weight loss or just a general lack of energy. These can be indicators that your loved one might be having difficulties right now. These stages of change. To pivot slightly to talking again about the treatment process and the process an individual goes through in their recovery. It is likely that every treatment option, agency, provider that you or your loved one might access are going to use these stages to identify and help support where somebody is in their addiction at this point in time. So, starting here on the bottom left with pre-contemplation. At this point, an individual may not be considering change at all because they likely don't see their use as a problem. They're not willing to pay the price of change because to them, they perceive the benefits of their use as outweighing the consequences. Then we might see an individual move to the contemplation phase. At this point, a person is considering change. They may be becoming more aware of the consequences of their use and wondering what they could do about it. At this point, they're not dedicated necessarily to the change process, but they're thinking about it. Then an individual may move to the preparation phase. People in this stage are planning on changing very shortly. They're starting to look at their options and they are starting to look at what the real consequence benefit of that change is going to be and how to go about it. The next phase is action. At this point, a person either is actively trying to change or is actively making plans to change. Next phase is maintenance. By the time an individual has gotten to maintenance, they have maintained that changed behavior for a significant period of time and are no longer experiencing the same problems that they were way back in pre-contemplation, again, because they have made a change to behavior. This last phase you can see is sort of out from the rest of them because it's a controversial one. Some individuals think that this phase is real. Others think that you just remain in maintenance for the rest of your life. At this stage, it's termination, where an individual leaves the change cycle, again, because they are so confident in their ability to no longer return to the old behavior that they're not caught in the change cycle at all. Along this entire continuum, it's typically not a simple A, B, C, D all the way to the end. Usually there's some back and forth, and this is due to the chance of lapse or relapse, which is a natural part of recovery. And this would be a time where either an individual momentarily gets off track, maybe returns to the old behavior for a brief period of time, and then decides to get back on and continue through the change cycle, or the chance of relapse, where an individual may have a complete return to old behaviors for a significant period of time. Again, this is a natural part of recovery and serves to support paying attention to maybe a gap in treatment, maybe a gap in their need, or reconsider the plan that they've currently made on how to change, as there may have been something missing in the first place. Here's a really simplified version of what we might hear a person say in any of these stages along the change cycle. So again, it's a really helpful tool to inform us what kind of intervention someone is ready for when they walk through those treatment doors or when they're home with their loved ones. It might not be super helpful to offer somebody a huge list of treatment options and demand they choose one if they're at that first phase saying, no, not me, I don't even have a problem. However, it could be really beneficial to offer our perspective of what we see is going on, some of the concerns that we have, to open that door to help them move to that place of, well, maybe people around me are noticing something might be wrong. And on the flip side, it might not be super helpful to only offer options and education to an individual who's saying, okay, let's do this. They might benefit more by having somebody there with them to walk through those next action steps and work on those next action steps to get towards a place of maintaining their change. So you might now be thinking to yourself, well, my loved one has been stuck in one of these stages of change for days or weeks or months, or maybe even years. And we recognize that there are some valid reasons why individuals might be feeling stuck in this change cycle. Number one is they may have confused reasons for change. They're not entirely sure what the consequences and benefits are of remaining the way things are now or making some type of change. Alternatively, they may be trying to make change for someone else's reasons. I'm going to talk about this a little bit more on the next slide as well, but we know that individuals have greater success when their change process is their choice. They may not be seeing their use or their gambling clearly, so they're not aware of the consequences that it is having, or they may be having unrealistic goals, expectations, may not being fair to themselves when it comes to what change could be or should be for them. They may be only trying to change part of the problem. If, again, we try to only shave away the top of that iceberg without addressing everything underneath, it can make someone feel quite stuck and like they keep returning to the behavior from the past to manage it. They may be unclear about what and how to change or overwhelmed with the unexpected in that change process. They may also be being impatient. It does take time to practice new behaviors, and it can cause a loss of motivation if we're not giving ourselves some positive reward or recognizing the changes we are trying to make. We may be simply not learning or practicing those new behaviors, however, even if we are attending treatment, or not modifying that plan as needed if we are trying new behaviors and something's just simply not working. Likewise, if we forget to give ourselves that positive recognition about the changes we are making, it was caused by positive reinforcement as a reason to develop the addiction in the first place. We need positive reinforcement to enforce the changes that we're making and the direction we're heading. We might not be aware of all of the options that are out there, or we may simply not like the options that are currently available to us. This last one, I want to try and alleviate if this is one of the reasons that you and your family are feeling stuck by going through that treatment continuum of options. A few of them we offer here at CMHA Thames Valley, and a few of them we might only be able to provide support in how to refer to and get to those options. First one I'm going to address is actually community treatment. So community treatment involves 1 to 2 hour sessions, typically once a month or slightly more or less frequently, depending on the person. These are brief interventions, meaning it could just be for a few months, could be longer, designed to help individuals develop their treatment plan, develop the new skills they need to better manage things under their iceberg, identify what their goals are, and this can be done both one-on-one as well as in a group setting or a combination of the two. This allows individuals to obtain and access treatment while also living other roles in their lives, like continuing to attend work, continuing to fulfill their needs as a parent, etc. There is research evidence that community treatment can have just as successful as a result as more intensive forms of treatment like residential, which I will address in a moment. And for many individuals, this is the least intrusive form of treatment, as they're, again, able to continue to live their lives and practice new skills in their realistic environments. We also do offer case management more generally for mental health concerns, not specific to addiction, which mainly is providing support with system navigation, assessment, finding treatment options, offering referrals. Like I said, this for some individuals is needed for one of those mental health pieces, but not necessarily specific for addiction. Withdrawal management services is something we offer in 2 ways here at the agency. We do have community withdrawal management services here in London and throughout the regions, where individuals are typically meeting with a nurse to discuss their taper planning, discuss best options on how to manage those acute withdrawal symptoms as they may be reducing their substance use in the near future. The other kind is residential, where someone may go live somewhere for a short period of time, maybe just be a few days as they withdraw from that substance. In London, the Salvation Army offers a non-medical withdrawal management option, and in Elgin, it's run by us here through CMHA Thames Valley. Short-term residential treatment is something people commonly refer to as rehab. The short-term portion, they're typically 3 to 4 weeks in time. This is where an individual goes and stays at the facility for, again, a period of time, period of weeks, and receives treatment, whether it be through groups, one-on-one, other structured activities. They're designed to help individuals develop and practice the skills needed to change their problematic behavior, while also taking them out of an environment that may be contributing to the problematic behavior. So in this case, for people who are really ready for and need that level of intervention, it can be extremely beneficial. And again, we can provide support with referrals to it. However, we do know that research shows that for individuals who are attending residential treatment, and it's not their choice, they may be attending due to pressures legally or from family or friends, they tend to have less successful outcomes, and it is likely that they will relapse within 1 week of leaving treatment, which can lead to feelings of disappointment, lack of success, feeling bad about ourselves. So this is one of those other reasons why typically we start with this least intrusive form of treatment and then decide later if we need something more intense and that would be appropriate. There's also long-term residential treatment programs where individuals might attend actually for months or years, very similar to short-term, but with that longer stay if someone needs that level of treatment. Continuing care services are often offered by these residential treatment programs as a way to ensure that when individuals do go back into their communities, if they're willing to engage with continuing care, they can discuss how everything they learned while away in that residential can be applied to their day-to-day lives. And the last one I'm going to mention today is self-help groups. These are things like Alcoholics Anonymous, Narcotics Anonymous, Smart Recovery, Gamblers Anonymous. These are places that offer peer support for individuals who have experienced or are experiencing a similar concern related to addiction. And they're offered both in person across communities as well as virtually for individuals who might not have one or can't access one in another township. I want to make a few notes about this Ontario addiction treatment continuum. The first is that treatment is individualized. There is absolutely no one-size-fits-all approach. And just because it worked for somebody else doesn't mean it's going to work for another person in another circumstance, which is why it is important to consider all of the options and even try a few before we can find what's a good fit. Treatment goals can range as well, from abstinence or sobriety through to moderation and healing that relationship with the substance or with the behavior, to harm reduction. If we know an individual is going to continue to use anyways, how can we do it as safely as possible? The Ministry of Health and Long-Term Care residential programs can be covered by OHIP. They do require adherence to an admission and discharge criteria, which if your loved one is accessing treatment, they can absolutely explore that with their counselor if they're accessing community treatment here. As well, non-addiction specific supports, such as getting good nutrition, investigating our sleep patterns, participating in physical exercise, fulfilling our needs and desires related to our education or employment, improving our relationships to the people around us. These are all extremely important parts of addictions treatment, as they are essential and assist a person towards that place of feeling more positive and better managed to cope with or reduce some of the stressors they have in their lives. Occasionally, however, these other life issues cannot be entirely addressed through addiction treatment and may need additional support through a psychiatrist, a more general mental health counselor, or psychotherapist. Maybe it's a specific group related to anger management or self-esteem. So often these can be be important parts of the treatment process as well. Our programs here are always evolving, so please do head on over to our website for the most up-to-date information. At the point of filming this video, these are the core programs that we offer for addiction-related services. I'm going to review each one of them quickly, what they are, just in the event you think it might be supportive for your family member. First, there's ASH, or the Addiction Supportive Housing Program, where we have a handful of units in conjunction with the London Middlesex Community Housing that provide both rent geared to income housing as well as addictions counseling in the same environment. Addiction transitional case managers are available in the hospitals across the region to connect with individuals and try and ensure there's a smooth transition into addiction treatment if they need it. COPE is the Community Opioid Addictions Program dedicated specifically to supporting individuals who currently are experiencing an addiction with opiates. CWSP is the Community Withdrawal Support Program that I mentioned, where individuals can meet with a nurse to discuss their physical health concerns related to withdrawal. Heartspace is designed for moms of children age 6 and under who are currently experiencing an addiction and the unique ways that they may need support or may have involvement with child aid services. Problem gambling and behavioral addictions is our counseling and treatment for individuals who are experiencing an addiction to something like problem technology use, gambling, as well as overspending and hypersexuality. Court support is designed to support individuals who may be both experiencing addiction or have experienced an addiction and also involved in the legal or justice system. RAM is the Rapid Access Addictions Medicine Clinic, offered here on site in London, as well as in locations in the regions, which I'll get to in a couple of slides. Here, individuals can access addictions medicine, specifically Suboxone Supplicate, that can help with reducing opiate use, as well as naltrexone, different than naloxone, which can support cravings and urges for alcohol use, as well as a few other types of medications or ways to use those medications. Substance use program is for adults who are experiencing substance use or alcohol concerns. We also offer it on an outreach basis in the community for people who cannot make it to the offices and to youth specifically. Breaking Free Online is something we do in conjunction with another organization to offer that online self-guided support for people who may not be able to make it to their appointment in a timely manner or want to use it as a way to further and continue their treatment. Back on Track is our only service that is not provided with for free or without fee, as it is a remedial program that is off or must be taken by individuals who have had a driving impaired charge. Withdrawal management, as I mentioned, in Elgin, we do have a number of beds, and those are expanding at point of recording this to have individuals come and stay while they withdraw from substances. We offer many of our services in French language as well, and we do offer EAP Employee Assistance Program for the Leona 1059 Union. So if your loved one has expressed interest in perhaps connecting with one of our services or supports, I would encourage them to head on over to our website if they're able to, take a look at what we have to offer, and they can start the intake process there. Likewise, they can give us a call at our extension 1222, which is the intake team, if they'd like to get a bit more information and or cannot access the internet in this way. You yourself can also head on over there for some more supports. You likely have already completed the intake if you're watching this video, or pass it along to others in your family who might also benefit from this. As I mentioned, we offer our services in a variety of regions and catchment area. First is Middlesex County, London, Strathroy, Elgin County, St. Thomas, West Lorne-Elmer, and Oxford County, which is Woodstock, Ingersoll, and Tillsonburg. And if you're not in one of these specific locations or in townships or areas surrounding, these are just our main sort of office and access points. So know that you can also access services even if you're in a surrounding community. Before I wrap up this video, I want to steer us in the direction where we're going to pick up during the live family group, and that is talking about how this has impacted you, how this has impacted the people around you, your life, and your ability to live your life. As we know that for many individuals, addiction can become not only a problem for the person experiencing it, but a problem for everyone around them. So we want to make sure you have a space to explore these themes, how they apply for you, and how to move forward from there. These are the parallel processes, and we hear this happening quite commonly to family members, close friends, and significant others when they're involved with somebody who's currently experiencing an addiction. For the person with the addiction, they may begin to avoid painful feelings, and we notice loved ones tend to begin to do the same thing. As the person with the addiction, their mood is dependent on access to the substance or access to the gambling or gaming. We see family members' moods can often become dependent on their loved one, on how they are doing. If they're having a good day, family members have a good day. If they're not doing well, family members are not doing well. For the person with the addiction, they may begin to engage in thought patterns that help them maintain the belief that everything is under control, while family members may also start to engage in behaviors and thought patterns that try to help them maintain the belief that everything is fine. As the person with the addiction's tolerance grows to the substance use of behavior, we notice family members' tolerance to their loved one's behavior also grows. And what was once shocking now doesn't seem like a surprise. For the person with the addiction, as their substance use may become all-consuming, for family members, their loved one's behavior becomes all-consuming. We tend to notice increased isolation and alienation for the person with the addiction and their family members. And lastly, as the person with the addiction's life starts to feel unmanageable and their substance use or behavior starts to feel all-consuming, like an obsession for family members, their lives start to become unmanageable and their loved one's behavior begins to become all-consuming. In the next step of this program, if any of these processes resonated with you, we hope to address this, and we are going to address this in our first live family group session. During this live family group, we want to recognize again how addiction affects the whole family. We want to give you a forum in which to discuss your emotions, your strategies, your successes, your challenges related to coping with and managing having a loved one who experiences addiction. And lastly, we hope to support you in learning healthier ways to support both your loved one and yourself through the addiction and recovery process. Before I conclude, here are a handful of resources in the community that you may want to access or consider accessing. Again, we can address these in further detail during the live family group. Number one is those self-help groups that I mentioned at the very beginning. Here's a number of links to those ones in this area. Connects Ontario is a great resource for system navigation. If you're not sure what else is out there for your loved one, including different types of treatment facilities beyond CMHA Thames Valley, you can head on over there, have a live chat with an agent, and talk about what kind of services you're looking for. Reach Out is our 24/7 crisis hotline. If you yourself or your loved one is experiencing something that you feel needs immediate support and don't think that hospital is a good option. Dia Counseling as well as Family Services Thames Valley both offer scaled counseling one-on-one services. If after our family group you feel like you need more of that one-on-one support to talk about and work through what's currently going on. Tandem is another telephone crisis service specifically geared at youth. We also have the Mental Health and Addictions Crisis Center, which is located at 648 Huron Street. If you need or your loved one needs to go somewhere, again, during crisis and doesn't think that hospital is a good avenue. Problemgambling.ca, as well as our problem gambling information line, are both good places to go for more information specifically related to concerns with gambling. And lastly, there is the Withdrawal Management Center, as I mentioned, here in London, where an individual may go if they want that acute withdrawal support in residence. Thank you so much for joining me for this informational video. I hope that you've learned something, found something helpful, or want to learn more by the time we get to that live family group. And a reminder, do please bring your questions for that day. We'll be happy to go through them. I look forward to seeing you on that first evening. Bye-bye for now.